Welcome back to the KOAM Morning News on this Med Day Thursday. Earlier, we're fortunate enough to be joined by Lindsay Rollins of Mercy Joplin. And Lindsay was kind enough to come back because I had some additional questions, with April being Foot Health Awareness Month, because Mercy has a very unique treatment, a hyperbaric chamber. Lindsay, people may know the phrase, they may not know what it looks like, they may not know what it does. What's your elevator speech, and how do you explain hyperbaric treatment to patients?
Absolutely. That's a great question, because when somebody says hyperbaric oxygen treatment, that sounds like a lot. But basically what it is we have a clear tube that you're put in, and don't sound claustrophobic. We can talk about that in a minute if you want to. But basically what we're going to do is, in that tube, we're going to put you in 100% oxygen, and then we're going to put pressure into that oxygen. And there's a lot of science that goes into it, but basically what it comes down to is, in a nutshell, is that we can get more oxygen to your ulcer. And we know that oxygen helps healing. So as we increase the amount of oxygen in your body, our bodies are so fascinating. It knows where that oxygen needs to go, and it'll go to the wounds that we're trying to heal, so that we increase the ability to heal these wounds.
And I do want to talk about that claustrophobia effect and kind of the process of it. But before we get there, I would like to ask you, who qualifies for hyperbaric treatment?
Great question. And we get this a lot, so I'm super glad that you asked that. It's kind of a falsity that anybody can qualify for hyperbaric oxygen therapy. So in our center, we follow the Medicare guidelines for who is approved to go into the hyperbaric oxygen therapy. And what this means is there's research to prove that this is beneficial. But 3 of the most common are diabetic foot ulcers, but not just any diabetic foot ulcer. We call it a Wagner grade 3. And really what that means is there's an infection in the deep space, or there has been, with that same ulcer. So a diabetic foot ulcer that has had a deep infection, candidate for hyperbaric oxygen, if it's not healing within 4 weeks of us treating that with what we know will heal wounds. So those diabetic foot ulcers are great candidates. They can go into the chambers. Our refractory osteomyelitis. Super big word. What does that mean? Infection in the bone. So any ulcer that has had an infection in the underlying bone, and that's been treated, and the infection has came back, but that also meets criteria. A third one that's a common one is a radiation, soft tissue radionecrosis. What does that mean? Somebody has had radiation, usually for cancer, to an area. We know that radiation really kind of obliterates those small blood vessels. Somebody gets an ulcer in that same location, they need a little bit more help with the oxygen that the hyperbaric oxygen can provide.
All right, so Lindsay, I've got a friend, a relative, a loved one who meets those 3 criteria that you were talking about, but at the same point in time, they're apprehensive, they're afraid, because they've heard it's a tube, they've heard it's compression, they've heard it's 100% oxygen. How do you assuage those fears?
Absolutely. That's a wonderful question, and it's a question that we get a lot. So I'm super happy that you asked that, so I can address that. The first thing that I would talk about is we are here for you. We are here for your loved one. We are here to make you feel comfortable and to address every facet of wound healing. So the first thing is to come meet us, get established with us, so that we can form that relationship, so that when you have fears, when you have questions, when you have concerns, we're here to answer those questions and those concerns. The second thing is hyperbarics. It sounds super scary. It really isn't. One thing to kind of think about is, you have an ulcer. What are you willing to do to heal that ulcer? If you're going into the hyperbaric oxygen chambers, if you meet those criteria that we talked about, then there's an underlying problem. It's not going to heal with antibiotics. It's not going to heal with some of the more simple things. So we really need that to increase the healing potential.
Yeah, I've even known some people, Lindsay, that have taken naps in there. They get so comfortable. Lindsay Rollins from Mercy Joplin. Lindsay, I want to thank you so much for not only everything that you do for our wound care patients, but just taking care of the 4 states in general, and for joining us on this Med Day Thursday.
Absolutely. It's my pleasure. Thank you for having me.
All right, we'll be back with more KOAM Morning News right after this.